to this Tech Takeover edition of Vet2Vet. I'm Sam Sacasa, a certified veterinary technician and Vetfolio educational specialist. Today we are welcoming Chantelle Hanna, certified veterinary technician and veterinary technician specialist in dermatology from the Dermatology Clinic in Charlotte, North Carolina. We're going to talk about the role technicians play in assisting dermatology patients and in turn, streamlining practice workflow. We'll discuss some exciting educational opportunities from Zoetis and share some great ideas to get your practice ready for Itchy Pet Awareness Month. Chantelle, can you first tell me a little bit about your experience as a veterinary technician specialist in dermatology and why you decided to go down that route?
Yeah, absolutely. So I've been a CVT since 2002. I started work in Angel Animal Medical Center in Boston. Around 2006 is when I started to work in dermatology. In 2011, I took my career as a dermatology technician on the road. And in 2016, I ended up in Charlotte, North Carolina. I fell into dermatology actually by accident, and I just loved it so much that I ended up working with a group of fellow technicians who also really loved dermatology. We worked to get a veterinary technician specialty together through NAVTA. We did actually get our provisional chapter established in 2015, so we're coming up for our full acceptance in 2025.
It's amazing. So you're a trailblazer. You started an academy.
Yes, we did.
I love that. I think that for any of us working in veterinary medicine, it's so important to find the areas that you're really passionate about. And I know that in my own experience, dermatology cases can be really rewarding. So, Chantelle, what are some examples of how you and your technician colleagues assist with dermatology at your practice?
Yeah, so we are a dermatology only practice. Our dermatology appointments really begin and end with the technicians. So for new appointments, everything begins with a really thorough history. Even before the client enters the building, we're reviewing all of the records that the referral vets have sent us. We're going through the client forms that we've asked the clients to fill out. We then have to go into the room, put all that information together, and really figure out what questions to ask. We need to know a lot of the basics that you would ask in any appointment. So the signalement of the pet, the symptoms, start and progression. We want to know what the client experiences at home on a daily basis. It's really the job of a dermatology technician to take that history to the next level. We need to be able to figure out what is different about this pet. Do we need to ask more specific, detailed questions about certain things? Do we need to get into a vaccine history? Do we need to get into a surgical history? It's our job to figure out, do these things matter to the dermatology history?
Yeah, that makes a lot of sense. I can see how getting a history for dermatology could be challenging because, right, a lot of times people maybe don't remember when the problem started, or yeah, I can see where questioning, where getting a history can really be an art.
Mhm.
When it comes time for a recheck, how can we as technicians best assist in facilitating that appointment?
Yeah, so similar to the new appointment, recheck appointments, we're basically taking everything into account since that patient was last in the building, which means what they're supposed to be doing at home, as well as any communications that we've had with the patient or with the client since they left the building. Did they have any issues? Were there any problems that arose since the last time they were here? And we go through all of that with them and make sure that they were dosing the pet appropriately and that they didn't have any issues, and how's the pet doing. Beyond just the recheck visit, it's also a daily list of responsibilities that we'll have to be responsible for. So in between appointments or during appointments, we're going to be setting up and maintaining all of our specialized equipment, like our video otoscope, as well as the CO2 laser. We're going to monitor our DTM plates. We're going to also make all of our own immunotherapy for the pets that are on allergy immunotherapy. We make that all in-house. So there's a lot of stuff going on behind the scenes as well. And then, of course, for any of our appointments, we're always going to usually be the last face that the clients see, with the exception of the receptionist when they're checking out. We're going to be going back into that room and discharging those patients, making sure that we're going over everything with them so that they don't have any questions.
Yeah, I mean, you certainly do a lot. And you mentioned that client communication aspect. That's always so important, right, in everything that we do. But I can see where that's specifically so in dermatology cases. Um, in your clinic, how do you and your colleagues tackle client communication, both in the exam room and after the appointment? I know you spoke a little bit about that, but can you elaborate?
Yeah, absolutely. So client communication is really the backbone of being a dermatology technician, because let's face it, the dermatology technicians are probably spending the most time with the client in the exam room. So after we do the history, the doctor takes a look at the pet. They've discussed a treatment plan with that client. We're going to go back into that room and we're going to take an estimate into them. We're going to discuss everything in regards to that patient with them, not just the costs on the estimate, but we're also going to be making sure that they don't have any questions about prognosis, about the procedures that we're going to be doing, about the diagnosis. And we're definitely going to be going over any medication questions that they may have, or any medication treatments that we're going to be asking them to do. So we also do, so depending on the appointment, we'll also be going over how to administer allergy injections with them, teaching them how to do their sub-Q injections, teaching them how to do their sublingual immunotherapy. At the very least, we're going to be talking about how do they give their medications. We're going to be showing them how to administer topical therapy, how to bathe, how to instill ear meds, making sure that there's not going to be any issues with them doing these things at home.
I can imagine that for a lot of owners, that's overwhelming, but it sounds like you take a lot of time to explain things really thoroughly, set proper expectations. So that's so important.
Yeah, it really is. Because client education doesn't end when they leave the building. There's going to be questions that come up. There's going to be issues that come up after they leave the building, and we're going to be there for them to talk about those things either by phone or by email.
Can you specifically speak more on the importance of skin cytology and how technicians in your practice support these diagnostics?
Absolutely. So cytology is so important. How
Mhm.
can we know whether there is a bacterial infection or a fungal infection? Perhaps there is a little bit of both. Perhaps there's actually no infection whatsoever, and we're looking at a sterile pustular disease. The only way to know is to do cytology. And how can we gauge a response to treatment if we're not doing cytology? And this is where technician appointments can actually come in really handy, because the technicians can be responsible for monitoring a response to treatment in between the doctor visits. And so technicians can see patients back. They can sample areas that have previously been sampled. We can look at them under the microscope, and we can know whether or not the treatment plan is working. Is there less of an infection? If so, we can let the doctors know that the treatment plan is working. Does there seem to be no response to treatment? We can let the doctors know that, and they can actually change their treatment plan in between the regular rechecks. So it becomes a really important part of our day and a really important part of getting that patient better.
I really love that idea of having that monitoring be a technician appointment. I think that's such a great way to make the workflow more efficient. It's such a good use of technician time. So, what are some additional tools for technicians to get more training on skin cytology?
Yeah, so Zoetis has sponsored a NAVTA technician training course on dermatology cytology at ce.navta.net. Is called the Team Approach to the Itchy Dog Certification Course. It is free and it's 1 hour of CE presented in 6 short 10-minute modules that covers everything from how to obtain the cytology to interpreting the results under the microscope. And then after that, it's just practice, practice, practice.
So, speaking of opportunities in dermatology education for technicians, I understand that there's a technician certification program by Zoetis that provides training to credential technicians on giving follow-up cytopoint injections. How does this program help with the care of canine patients who are on cytopoint for the treatment of allergic and atopic dermatitis?
According to Zoetis market research, 46% of follow-up cytopoint injections are now given by veterinary technicians. So the program is timely. We want our technicians to feel trained and comfortable with giving those injections. And a clinic that can offer technician-based appointments to do these is basically offering better appointment availability that works around owner schedules better, therefore increasing client compliance. It ultimately offers us a better chance to help our itchy dogs with atopic and allergic dermatitis.
I have noticed that cytopoint injections are usually done by technician appointments now, so I think that definitely is becoming the mainstream way to do it. And so that sounds like a great resource. For anyone who might be interested, can you share some details about the program?
Yeah, absolutely. So it's a 2-part program. And technicians can first start by going to www.cytopointtechtraining.com. They'll listen to a 12-minute presentation given by a fellow veterinary technician specialist in the field of dermatology, answer a few questions, and then they can request a CytoPoint toolkit in order to help get this program up and running at their practice.
That is so cool. I think that knowing the basics and feeling confident about administering Cytopoint will provide assurance to the clients and help these appointments go really smoothly.
Mhm.
So, I heard you mention the toolkit. Can you tell me a little bit about what the toolkit contains?
Yeah, absolutely. It contains a CytoPoint folder, which helps keep everything neat and organized. There's a dosing guide, a program reminder with communication tips for owners, a tear-off pad with a checklist of the questions to ask owners, a laminated skin lesion image sheet, a cytoplan to give owners to remind them of their next appointment date, and a CytoPoint owner brochure. And there's also an itch tracker so pet owners can share their pet's itch level with the veterinary team.
That is so cool. I love it. They all sound like amazing resources. And so, with that, we know that client compliance and follow up is really important. And as technicians, we have a pivotal role in educating owners about rechecks and monitoring for flares. So, Chantel, what are some ways that we as technicians can encourage pet owners to recognize allergy flares and be compliant with follow up appointments?
Yeah, so I think there's really 3 things that we can do. And number one is to get that client to schedule their follow-up visit, whether it's a recheck or the next CytoPoint injection, before that client ever leaves the building from that appointment. And this is where our great reception team really comes in handy as well, and that they're on the same page in helping to get those appointments scheduled. The second thing is to educate owners and remind them some of the things that their pet tends to do specifically when they're starting to flare, and encourage them to call right away and not to let things snowball. So at the first sign of redness or increased itch or increased shedding, pretty much anything that they're not sure could be the first signs of a flare, we want them to call and not wait. The third thing that we can do is actually to initiate those follow-ups. We can set reminders to call our clients or email our clients and just check in and say, how's everything going? Did the cytopoint injection help? Have we noticed any increase in signs? And just generally following up with that client may be helpful to them because life gets busy, right? And sometimes they mean to call and they just forget or don't have time to do it. So
Yeah, absolutely. I love that point you made about making sure that owners can really recognize the signs of flares early on, because I think sometimes it does wait until it gets bad, and then it's, of course, much harder to treat.
mhm.
So I think that that's a really great point. So can you tell me more about the Zoetis Cyto Plan and Cytopoint reminder tools and how they can work to increase compliance?
Yeah, absolutely. So ideally, remember, we want to forward book that next cytopoint injection before the client leaves the building. The cytoplan helps us do that. We should know after the first 2 injections what that dosing interval is going to be for that pet. And typically it's 4 to 8 weeks. So we can go ahead and book that appointment, send that cytoplan home with the owner so that they have a reminder of when that date is. Hopefully that helps them understand the importance of coming back for that visit and so that the dog symptoms don't snowball out of control. The other thing that they can do is they can go to Zoetis for reminders, and that is going to be www.zoetispetcare.com/reminders for help in reminding them about their appointments.
So it's summertime, which is my favorite season, but not necessarily a favorite season for dogs with itchy skin. I understand that Zoetis dedicated the month of August to itchy pets. Can you speak more on this?
Sure. But first, let me ask you, did you know that there are almost 8 million itchy dogs that have not been seen at their veterinary clinics for their itchy skin?
Ooh, I did not know that. I wish I could say it was surprising, but I think a lot of us technicians know that there are a lot of itchy pets out there.
I think it's compounded by the fact that some owners don't even realize that their pet is itchy because they don't equate symptoms like foot licking with their pet actually being itchy. And so the team at Zoetis has decided to dedicate the month of August to pet skin health, calling it Itchy Pet Awareness Month. The goal of Itchy Pet Awareness Month is to generate awareness about pet skin health and to encourage clients to get their pets into their veterinarian to be seen for their pet skin health.
I think that that's a really cool initiative. It is such a common problem. So yeah, that seems like a perfect way to address it.
So this is actually the 5th year of Itchy Pet Awareness Month. Many over-the-counter or home remedies that clients read about on the internet or are recommended to them by family and friends don't really help to treat the itch and actually prevent or delay diagnosis as well as delay an effective treatment plan for those pets. But things are getting better. In 2022, over 9.5 million itchy dogs were seen at their veterinarian for their skin health, and there's been a overall 40% increase in itchy pets being seen at the vet in the last 5 years.
Those are really great statistics. That's amazing. It seems that a lot of owners are really starting to understand that pruritus can be treated. And I think that we can help in our practices by raising awareness that allergic itch is a medical condition that needs veterinary treatment. So, Chantelle, for anyone out there that hasn't yet participated in Itchy Pet Awareness Month, where can they go to get started?
Yeah, so Zoetis has a newly updated website that's dedicated to all things Itchy Pet Awareness Month, and it is www.itchypetawarenessmonth.com. And practices can go to this website. There are a lot of tools and resources to help them implement Itchy Pet Awareness Month at their practice. There's things like customizable Facebook and Instagram posts they can share to their social media. There are waiting room as well as exam room posters. There is a team protocol for allergic itch that helps to make sure that everybody in the practice is on the same page when it comes to these patients. So there's a lot of resources there to help us help our clients with pets that have allergic and atopic dermatitis.
I love the idea of communicating this to pet owners because this is a condition that's so frustrating. And it sounds like there are so many good resources. So, what about other creative in-clinic promotions? Do you know of any fun ideas that you've used or heard of other clinics doing to get ready for Itchy Pet Awareness Month?
Yeah, absolutely. Giveaways are a great thing to generate excitement because who doesn't love giveaways?
For
And
sure.
so giveaway contests are to pet owners who bring their pets in for skin health checks in the month of August are great. Things like putting a bunch of flea combs into a jar, and the winner is the person who guesses the closest to the number that are in that jar. Prizes can include food trial friendly treats, uh, maybe free medicated baths, or a free grooming, or even a free day at the doggy day spa.
I love it. Those are all really great suggestions. Yeah, there's just so many things we can do, right? Like you can have before and after pictures of derm cases
Mhm.
because sometimes it's really remarkable.
Yeah.
Just, yeah, what a short amount of time, what a difference it can make.
Yeah, for sure. And some of the transformations are pretty dramatic. Those are great
Yeah.
ideas. And I've even heard of some clinics doing like um, doing a Facebook fundraiser for rescue pets with derm issues.
Well, that just speaks to my heart because I love rescue animals. So I think that is such a cool idea. Thank you for taking the time to discuss how we as technicians can effectively assist in managing chronic allergic cases and for discussing the importance of Itchy Pet Awareness Month. Do you have any final thoughts for us?
Yeah, absolutely. Like you said, client communication and follow-up are just so important. And the more we as technicians feel empowered to talk about treatment plans and discuss treatment options with them, the more we can increase client compliance and the happier and healthier that our patients will be for it. And don't forget Itchy Pet Awareness Month.
I think that's all great advice. Thank you so much for taking this time to discuss how we can effectively utilize technicians in dermatology cases and for discussing the importance of Itchy Pet Awareness Month. And thank you to Zoetis for sponsoring this Tech Takeover edition of Vet2Vet. Check out vetfolio.com for more of our B2B discussions on various topics in veterinary medicine. And remember, great patient care starts with self-care. This video was sponsored by Zoetis, the makers of dermatology treatments including Apoquel, oclacitinib tablet, and Cytopoint. Cytopoint indications. Cytopoint has been shown to be effective for the treatment of dogs against allergic dermatitis and atopic dermatitis. Zoetis is dedicated to changing the way we in veterinary medicine approach canine pruritus due to allergic dermatitis to benefit the pet, the owner, and the veterinary team. Visit apoquel.com and cytopoint.com for more information.